You guys probably know 13 in house has this. We watch that a lot. So common names, it's most commonly called Huntington's disease or HD, but it can also be referred to as Huntington's chorea or Huntington's disorder. It's a genetic neurodegenerative disease that affects the central nervous system, and it's characterized by physical, cognitive, and also behavioral symptoms. It occurs in about 7 individuals in 100,000, so it affects about 30,000 individuals in the US. One of the most unique things about it is its inheritability. It's an autosomal dominant disorder, which means that if one of your parents has it, you have a 50% chance of inheriting it. Causes, it results from genetically programmed degeneration of neurons in certain areas of the brain, specifically the basal ganglia and also frontal cortex. More specifically, it's a genetic defect on chromosome 4, where there's a sequence of DNA called CAG that just repeats like way too much than it should. And basically, the number of CAG repeats you have, like the more you have, the more you'll be affected by the disease. So a normal person has about 28 repeats. A person with Huntington's has over 40. People with juvenile Huntington's disease have much higher than that. Who's affected? Mostly white people between the age of 35 and 44, but children are also at risk for juvenile Huntington's disease, which is a variant of the disease that affects teenagers. And it's when symptoms occur before the age of 20, and it occurs about 10% of HD cases. Brief history, this is George Huntington. He's an American physician, and in 1872 he was the first one to describe Huntington's disease as a specific disorder. And there are physical, cognitive, and behavioral symptoms. Physical symptoms are chorea, which is involuntary muscle movements, restlessness, poor coordination, jaw clenching, slurred speech. Yeah. Cognitive symptoms, difficulty with memory and organization, concentration, decision making, because it affects the frontal cortex, which is in charge, I guess, of some of this. And in the late stages, dementia usually occurs. Behavioral symptoms, hallucinations, anxiety, mood swings, depression, which can be in part because you have like neurodegenerative disease, but also it affects the part of the brain for that. Treatments, there's no cure yet, but there's medications that can help manage the symptoms. They're doing new drug trials. Diagnosis, they can get genetic testing at any time in their life, even when they're pre-symptomatic, which is kind of controversial because, you don't know, like, if you want to get tested or if you wouldn't want to get tested, so that's prognosis. They usually don't die from Huntington's, but they die from heart failure or other complications from it, and they usually live about 15 years after they're diagnosed. And then here's some famous people or characters with HD. This is House, 13 from House. We all know her. And then Arlo and Woody Guthrie are 2 people, brothers that had it. I don't know if they're still alive. And yeah, this presentation is dedicated to Maddie, Krista, Judy, and Pat.